is I'm opening it up so I can read a little bit because I don't have my glasses on, and then when we're ready for questions, I'll minimize it so I can see. Is that okay? All right. Broderick, is that you first? Yeah, go ahead.
Good evening, everyone. Thank you so much for the opportunity to have Univera here to talk with you a bit this evening about COVID-19. You know, there's a lot going on right now in regard to the CDC rules and the vaccinated folks and all of those things. And it was great to that you were able to ask some questions ahead of time, which we've received and had a chance to take a look at. So we'll be talking about those tonight. So my name is Broderick Kason, and I manage community engagement for Univera Healthcare. And I am pleased to be joined by my colleague, who is Dr. Bruce Naughton, who's been working with me in partnership on these COVID-19 conversations. It's been going very, very well. So once again, I want to thank you so much for the opportunity to speak to you all this evening. We are a sort of novice at this process, so let us know if we need to slow down in our speech or anything that we need to do that will aid and assist in things working out really smoothly tonight. So thanks once again. And at this time, I'm going to turn it over to Dr. Naughton. Thank you, everyone. And we'll have questions following the presentation. Thank you.
Okay. Good evening. It's really very nice to be here, and this is an exciting time to be talking about COVID. I am on the second slide, but I think we can move to the third slide. Perhaps everyone knows, I'm sure everyone knows, that there has been a decline in the epidemic. The number of cases has dropped dramatically. New York State still is in the top 10, but you can see from that data and the graph on the left how far it's gone down. And that is really good news. New York is leading in terms, we're high in terms of the number of people who are vaccinated. Over 52% of the state is vaccinated. And even more have at least a single dose. And we think that's a major reason why the virus is going down. Plus, there may also be an element of people who have had the virus. So we have a significant number of people who are not only vaccinated, but are also been exposed and so have another set of immunity without being vaccinated. So the whole idea is that the virus is abating. It has not gone away, but it's going down because we have more people who are immune. Let's go to the next slide, please. And that there's been, well, the deaths have been down, and that's good news. I can talk a little bit about that in terms of what that means. There may be another spot in the slides, but because I'm not sure, let me just say that the last time we had a major epidemic, which was N1H1, which was in 2009, we had we only had 65 million people who were infected. 65 million people, and we're not close to that with COVID. We're probably getting close to 30 million people with known infections, maybe a little more, but we only had 12,000 deaths in 2009. This is a very serious virus that has caused a disproportionate amount of deaths. High rate of hospitalizations, as you know, in New York State. Texas was having a major outbreak. Florida had, California had major problems. South Dakota had major problems. In addition to that, what I think is really disturbing, and I want to get across because because of the audience, is the people in the ages 25 to 44 have had the highest amount of excess deaths. So we have death records and rates going back many decades, and we know what the average is. And there was a huge spike in 2020, and that the number of people aged 25 to 44 increased the number of excess deaths by over 25%. The excess death rate where we saw the most deaths were in people over age 65, but the excess death rate was only 14%. So this illness has disproportionately affected and it killed older people, but it has not spared younger adults, and younger adults have had an unexpectedly high rate of excess mortality. That's right. That's not something I'm making up. That's not coming randomly from the internet. That is a CDC study that was published in September. We can move on to the next slide, please. We've talked about hospitalizations. So for younger people who were infected in the 25 to 44 age group, about 20% were hospitalized. And of those who were hospitalized, about 10% were in the intensive care unit. In the intensive care unit, there was a significant amount of mortality, but also major period of post-hospitalization recovery. We're still seeing people who have long-haul illness that affects memory, it affects the heart. It's not something to be messed with. The next slide is redundant, so I'm going to jump to slide 7 to talk about the variants. And the variants is one reason that what we're concerned about. Everyone must be well aware that viruses mutate. And one reason they mutate is because they reproduce so rapidly. Obviously, it takes a human being 9 months, and virus reproduces much more rapidly. I don't know exactly how fast. But every time there's a change, there's an opportunity for a variant to emerge. And variants that have a higher rate of ability to attach to their host, human beings, are thought to are able to spread more rapidly. And you have the variant emerging that would be different from the original natural virus. They're all natural viruses, but the variant would be one that has shown a genetic change since the pandemic began. And we have a number of variants now. There's a California variant as well. And there is quite a bit of concern and evidence that these variants can spread and are highly virulent or ability to infect people. That's one reason why they think there's many reasons why things have exploded in India. But one of the thoughts is that it is a highly infectious variant. We know that the UK variant, which is also known as B.1.1.7, which is there on the left-hand side of the screen, it's also maybe perhaps twice, 50% higher, almost twice as 50% higher than the more infectious than the original virus. And that's why we're so concerned. One of the reasons why we're so concerned about getting this under control. There are people we know who have mild illness and have tolerated it well. There are people, up to 30 to 40% of folks who are infected with the virus have no symptoms at all. But as long as this variant keeps circulating, it's possible that it will change in a way that the vaccines become less effective, or that it becomes even more virulent than it is now, and is able to infect people even more easily or spread more easily than the current rate. So that's why the variants are important. I will go into this in a little more detail when we talk about vaccines, but currently the variant is of concern because they are circulating, they will continue to circulate. But right now, the vaccines we have across the board, I think there's 17 vaccines out there. We have 3 in the United States, are all very effective against the variant. The Johnson & Johnson may not be quite as effective as the other two. We'll talk about that in a minute. Let's jump down to slide 9, please. So these are the 3 vaccines that are out there. Pfizer BioNTech is a very effective vaccine. It's given, we all know that these are 2-dose series. They've now lowered the age down to 12 for the Pfizer. The drawback from the Pfizer is that it has to be kept very cold in special refrigerators, so it is difficult to disseminate widely. It is very difficult, for example, to do that. And for our home care folks, people who can't get out of the house, it's not easy to get that vaccine to them. But it is highly efficacious at 95%, including the variants. The same can be said in terms of efficacy or ability to fight off infection or prevent infection with the Moderna. It hasn't shown the data on age 12 yet. I think they're trying to get down to age 6 on these vaccines. It does require 2 doses. The side effect profile with the Moderna is a little higher than it is with the Pfizer. So the Pfizer runs about 60 to 70% on side effects, particularly after a second dose, and Moderna runs more in the 80s. And we will come back to that as well. And I'll be looking forward to answering any questions. The Johnson & Johnson, the efficacy in terms of preventing infection is 60 to 70%. It is very easily distributed because it can be kept in a routine refrigerator up to 30 days. The downside, there is some concern about these excess clots in the Johnson & Johnson vaccine. That data is not conclusive, but of course, the government has put out warnings about clotting. It's occurring at about 1 person per million. It has disproportionately affected young women between the ages of 25 and 44. It is associated, the people it's occurred with have been with birth controls and cigarette smoking, but these clots occur about the same rate in the general population. So the data is still somewhat in question, but obviously if someone who smokes, a younger woman who may have a history of clotting or who's taking a higher dose of the estrogen birth control pills, and certainly something you discuss with your physician, probably should the recommendation would be not take the Johnson & Johnson unless there's no other choice. But again, the risk of that adverse event is extremely low. And we can talk a little bit about, maybe we'll get to a point where we talk a little bit about side effects from COVID, and the rate of clotting is much higher with a COVID infection. I think we can see. I think we've got us at slide 11 now. Yeah, okay, this is the order of the slides. We put these slides together very rapidly. They just keep moving because the subject keeps moving. So COVID-19 we've talked about is very serious. This is the largest pandemic we've had since 1918 in terms of deaths by a long shot. The proportion of the population is still more deadly in 1918, but we've had well over 500,000 deaths. We've had a lot of hospitalizations, and we've had excess mortality. So on these death certificates, the right complications of COVID-19, death certificates are notoriously limited in their ability to provide really accurate data, because often we don't really know. But there has been, for those we have attributed to COVID-19, we're well over 500,000. We're probably 125, 150,000 above that of excess mortality that is above what we would expect for lots of diseases or conditions or just deaths in general. So even though the COVID deaths are attributed to be about 500,000 or more, the excess mortality is well above that for a lot of reasons. Maybe caregivers have been overwhelmed. I've done a fair amount of review of looking at deaths at hospitals. They've done really well with the COVID. Sometimes they have not done so well with some of the care, I think partly because they've just been overwhelmed with COVID. We're going to keep saying over and over and over again, get a vaccine, get a vaccine, get a vaccine. That is the best way to protect yourself. But also I want to emphasize here, and hopefully Broderick will back me up on this later, this is not just about me. It's just not about you. It's about everybody else. So we want to stop the spread of this virus in the community. We want to stop the spread of the virus to people who have impaired immune systems. So I've got 5 or 6 folks who are all well over 80, quite frail. They were fully vaccinated in March, and all 6 of them have been reinfected with the virus. We've confirmed it. They have mild symptoms. We had one person who went to the hospital who was pretty ill, but we all thought for sure that he was not going to make it based upon our experience. But to our surprise, he turned around pretty quickly and came back. Very gratifying. What that means is, though, that he has an impaired immune system and doesn't fully respond to the vaccine. He has recovered, and other folks have relatively mild symptoms. Previously, we had several deaths related to COVID. So we want to stop this virus dead in its tracks. We want it to stop it from circulating, because even though young people think they may not have a serious illness, they are having some serious illness when they're infected. And they are still circulating in the community, and it can extend to others. So we're going to continue to have these problems about social distancing and masking, and we will talk about that because we know about the new updates until this virus is gone. And without widespread vaccine use, it's not going to go away. We have been ruthless in our working with the flu vaccine, and I have not had a death in my program since 2014 related to the flu. The vaccine came too late for some of our folks. So far, with the vaccine, we've had no deaths with COVID since we've gotten everybody vaccinated. We hope that's going to continue to be the standard. I think we can go to 12. Okay, let's talk about this. So this vaccine came up as an emergency vaccine, and people are saying, well, it's an emergency vaccine. I don't trust it. I'm not going to take it. There's a misunderstanding. There's a couple of misunderstandings there that I think we have to clarify. And so we can try to stick to the facts. First, the emergency authorization means primarily that the vaccine just moved to the front of the line. It didn't really escape a lot of the data and scrutiny that's required to get approval. It just means that it instead of waiting 2 years to get its approval and going through the normal queue, because of its emergency need, it was pushed forward, and the testing was fast-tracked. The other point that I think should be understood very clear is they've been looking at this. The Johnson & Johnson vaccine is modeled on the Ebola virus vaccine that came out just this past summer as well. It came out in, it came out in June of 2020, just preceding the Johnson & Johnson vaccine. That model vaccine, they started working on that vaccine in 2014. So the model for that vaccine was put in place in 2014. And it was 7 years of research that before that vaccine came forward. They took the same technology and used it for the COVID, and were able to produce the vaccine in a much shorter period of time. Similarly, the Moderna and the Pfizer vaccine, they're somewhat different in their mechanisms from the Johnson & Johnson. But that research for that vaccine has been part of the AIDS research going back to the 90s. So the technology for these types of vaccines and the way to impact the immune system is not new, but this was an opportunity to move forward. And they did not know that it was going to work with the COVID. They have not been successful, as you know, with the AIDS vaccine, but it was one technology that was developed as part of the AIDS research. So this technology is not new. The application is new. The point of this is different technology of delivering the protein that triggers the immune system to the human body. But what really matters is that the immune system is triggered. We have triggered the immune system with smallpox. I'm of the age when polio was still a serious issue, and it was viewed as a miracle and a great day, and people were lined up everywhere to get the polio vaccine. Measles in my generation was viewed as a very serious illness, and it abated because of vaccines. The response, the immune system response, is the same across the board. It's an antibody response to a foreign protein, and some of that response gets incorporated into immune memory cells. The same process occurs with the COVID vaccine. It's just a newer, updated method of triggering that immune system, and the protein that they were able to use very high technology to select a protein to produce the immune response. And that is one reason why the Moderna and the Pfizer are so effective, is because they picked the right particles from the virus to trigger the vaccine. None of these vaccines deliver any live virus or any intact virus, live virus or intact virus, dead or otherwise, to the body. One of the questions I had while we're talking about the subject, one of the questions I had in the past was, did you know that some of the antibodies can attach to proteins in the body? Yes, I'm sure that's true. When the COVID attacks us and we triggers antibodies, our antibodies go wild. One of the major concerns about this virus is that it triggers a cascade immune system that is out of control. So we can take our pick. Do we have a controlled viral response to the viral protein that grants us 95% immunity? Or do we run the risk of getting sick from a virus that can destroy our bodies? I think that's a pretty from a physician's point of view, it's pretty straightforward. And I think the slide here is pretty self-explanatory. Let's look at the next slide, please. So, how do we know they're safe? Well, it's been tested on millions. I don't know how many millions of people. What are we at? We're over 40 million people have been vaccinated. We're not seeing any major side effects. I scoured the internet, the press, the CDC, looking at these side effects, and it's all repetitive. There are minor side effects. Moderna and Pfizer both have side effects. At the time of the initial infection and injection, stab, they call it in England, there can be a local reaction. I personally did not experience any local reaction of any kind with the Moderna vaccine. There can be swelling in the arm, redness in the arm. You can ice it. People who have had prior infection with the COVID may have a little more reaction with the vaccine: aches, pains, fatigue, maybe a fever. The second dose of the vaccine, I personally felt low energy, fatigued. I wasn't achy, but I was just sort of low energy, no fever. My wife got a fever to about 101. My sons were not particularly impacted by the vaccine, but it's all gone in a day, which is minor. It's gone in a day. People who have serious allergic reactions, who may have an allergy to polyethylene glycol, which is one of the major ingredients in the vaccines, should probably not get the vaccine and should discuss with their physicians if anyone has a history of major allergies. Certainly anyone who's had a history of reaction, a major anaphylactic reaction to a vaccine, should discuss it with their physician. Probably should not get the vaccine, but decision not to get the vaccine based upon risks, based upon personal illness or history of allergies, is something obviously that I'm not going to be able to address individually here. and I would strongly urge people to discuss with their physician. And the information on the slides is pretty well straightforward. This is well-known technology. It uses part of the genetic code, which is used to produce the protein that triggers the immune system. The mRNA doesn't become part of your genes. They don't become part of your genes. They're not incorporated into the genetic code in any way. So we can go on to the next slide. We just said that. Okay, this we just said. So it's very clear. So I'm struggling, and I don't wish to challenge anybody, but I am struggling with reliable data that tells us that the vaccine is unsafe or can harm our bodies. We have many, many vaccines out there. We have no reliable data that vaccines are harmful, except under the rare unusual circumstances we talked about, for people without allergies, significant allergies, who are not allergic to the components of the vaccine, and they don't have eggs in them, they don't have any foreign proteins in them. I cannot find reliable data that says why a person who doesn't have those reasons is not vaccinated. We know that pregnant women now, we find it's safe to vaccinate them. There's been just so many, it's just a rapid use of this vaccine. And I'm kind of hard pressed to figure out people who talk about trackers that are put into the vaccine. I'm having a hard time figuring that out, because I don't know how you would have a microchip that could go into vaccine that could be delivered in that way that you wouldn't see in the solutions. So I move to the next slide, which is 15. As I've said this already. So we can go to 16. We've talked about the side effects here. Pretty straightforward there. I'm now on 17. We know there are locations. You can walk in. Broderick probably has more information about the walk-in than I do. They are doing pop-ups. In fact, I was out in Springville, New York, local restaurant, brewery. I walked in. They said, "Are you here for the shot and a beer?" Which I was not. But you could just walk in. I think there's enough vaccine out there right now that you can just walk in. I think our concern is that people who have access to the vaccine are not getting it. There is concern about people. I'm not sure we know fully about what access people have who would not go through the usual channels, who may have some transportation issues, who can't get in the house. We certainly would be concerned about populations of folks who may be undocumented or who are intimidated because of language barriers. But there are a number of sites, and if you go to New York, Broderick, I think, will have a lot of information about how to get vaccinated if you don't already have not already done so. Yeah, let's go on to 18. There is no cost to patients. I am a little concerned about going to your physician and getting the vaccine. There should be no cost associated with that as well. One reason people are going to pharmacy and the pop-ups is, first of all, it's pretty straightforward. It's pretty spontaneous for a lot of folks. Also, there's no charge. The physician should not be charging for this. This is part of preventive health, and it's not legal to charge for these vaccines. And there are physicians, perhaps, who may have it now. They're trying to get it in the physician's office. I'm not sure it's there yet. No. And on 19, we're just walking through this very slowly here. 19, you don't need a vaccine. You might get might need an appointment, as we've talked about. It's also good to have an insurance card. That's always nice. You don't need to have an insurance card to get vaccinated. It may be difficult to get vaccinated at a private physician's office if you don't have an insurance card. But for most of these other sites, most of the pharmacies, you don't need a card. 20, yeah, let's talk a little bit about the COVID-19 on slide 20. If you've had it, even if you suspect you've had it, it's possible to get reinfected. We think that risk is very low, very low. And but it's a good idea to get it. One of the reasons we want to get it, to get vaccinated, is we're not sure how long this immunity is going to last, and we don't know how effective the immunity might be for someone who was previously infected and then maybe come in contact with a variant. So we'd like to see everybody vaccinated. The risk of that is low. My son had had COVID and did get the vaccine, and he was a little more achy the first time, but he did very well, and it certainly wasn't any major illness compared to what he could get with COVID. There's another question here out there. I'm 21. How do you get the second dose? When you get your first dose, they generally give you an appointment for the second dose, and you just need to show up for that. If you miss it, it's not the end of the world. You should reschedule it and get it. And in some parts of England, they were going 2 months out. We don't recommend that. You should get a second dose. The first dose is pretty effective. They're saying now that's up to 80% grants immunity. You want to go to 95%. You want to get as much immunity as you can. You want it to last as long as you can. So the first dose, we don't know how long the immunity lasts. We don't know how long the immunity lasts from a second dose. We know that it lasts longer than if you get a first dose, but I think they're going out 6 months. There is concern that we're going to need an annual booster. We don't know that yet. I can certainly acknowledge that, but I don't think we have any data that's going to tell us that. I haven't seen any data that's going to tell us that just yet. Pfizer is working on that. They're also working on, I guess they're working on oral medication as well. And here we've talked about this. We want to see everybody vaccinated. The numbers in New York State on slide 22 are higher. They're over 50%. We want to keep going. As you know, the guidelines have changed. Let's see what we have on 23. Okay, let's go to 23 and we'll talk about the precautions. As you know, CDC, we can talk about that, and then I think I'll take questions. So the CDC came out and it said that people who are vaccinated can pretty well congregate as long as they're congregating other people who are vaccinated. The New York State, as of tomorrow, is going to adopt those guidelines, and it basically says that the restaurants can have areas where people who are vaccinated can be separate from people who are not vaccinated. If they want to require evidence of vaccination, they can, and they can give more leeway to people who are vaccinated versus people who are not. As you know, that at the stadiums, they're going to have separate areas for people who are vaccinated versus people who are not vaccinated. They're going to allow larger gatherings. They're allowing more flexibility for businesses about vaccination. The businesses that are going to be more liberal about the masks still have to maintain social distancing. If you're unclear about the vaccine, people are going to have to wear masks and maintain social distancing. If you're clear about the vaccine, then you can be much more flexible. The rules around flying have changed. There's not going to be a quarantine rule over testing before you leave the country, or testing other than testing when you come back is much more liberal. Everybody's going to be wearing masks. They're putting it back in, the middle seats. So things are opening up, but the ticket to a lot of that is going to be getting vaccinated. I think right now would be a good time to stop, and maybe we can take some questions. And I'm sorry I can't hear, so I look forward to the chat. Is everybody? Oh, okay. Great question. The other question is flying in here. Yeah, you do. Well, it's good to keep your vaccine card. You're going to be asked for it. New York has the Excelsior Pass, and that's a digital pass. I haven't gone onto it, but it is a digital pass that's available, and they're going to recommend widely used. The recommendation is that it not be laminated. Don't laminate your card because you may need it next year. If you want to protect it, you can get one of those little sleeves, I'm sure, at I don't know the stores, but there are a lot of stores where you could get a little sleeve that you could put your vaccine card in. You really should try to protect your vaccine card. I'm sure you can go back to the place where you got your vaccine and get another card, but that's kind of a hassle. So you really would like to try to keep it. The other recommendation, of course, everyone knows, is to take a picture of it and keep it on your phone. Right. So the question is, will we have another vaccine? And like, you mean like third or fourth? Very possibly we will have even another vaccine out there. It's not mandated now, but we may go through this again. I mandate that anybody who is working with my patients has a flu vaccine every year. And it's possible that we will be mandating the COVID vaccine as well. There are companies that are mandating that. There is some concern about it, as you can imagine, relating to disability and privacy, so that if you're unmasked, that gives some evidence of your masked or unmasked, that may give some evidence about your health status, and that is a bit of an issue. We know that the majority of us are vaccinated, then we don't really need to worry about the people who are not vaccinated, because the virus will not be circulating. We know that when they talk about herd immunity, 80% or so of people are vaccinated, maybe even higher for this one. Then the other people who are not ill, the virus will not be circulating in the population, and they will not become infected. I don't know what proportion of people would be who cannot be vaccinated, but it's probably less than 15% of the population. And so, I would like to see people vaccinated, and I have mandated it in the areas of the workplace where I am able to mandate it. And we'll see about next year. Yeah. Okay, sorry. Great question. Is encouraged to stop wearing masks right away, even if the said safe, we haven't hit herd immunity. We've not hit herd immunity. So if you outdoors, I never wore a mask outdoors. I was never in crowds. I was in parks with, a person who I knew well, and we were maintaining distance. So outside, if you're vaccinated, the risk is very, very low, and it's very safe. People who are not vaccinated should maintain social distance even outside, but probably don't need to wear the mask. Indoors, if you're with people who are vaccinated, you certainly don't need to be wearing the masks. If you're in a crowded area where there's going to be people who are not vaccinated, it's still ideal to prevent transmission to wear the masks. The likelihood that a person who is vaccinated will actually pick up the virus and transmit it is very low, unless the person has a compromised immune system, in which case they should continue to wear the mask until we have the virus not circulating in the population. There's some split opinion about how open you can be in a restaurant. Some people are saying going to restaurants, it's well ventilated, and if you're fully vaccinated is fine. Others are not quite as secure. There's a range here that is somewhat personal about how people feel about risk. I also want to remind everybody that if you're vaccinated, and if you were to get the illness, it is unlikely that it's going to be devastating. It prevents mortality. The other part about this, and serious illness and mortality, the other part about this is that you're unlikely to transmit it. But if you're going to be in contact with someone who is immune compromised, until we have it out of the circulation, if you've been out and about, it's probably best to wear the mask, just to protect that person until we're clear that the virus is not circulating. We've hit herd immunity. I hope I've answered that question. That was a good one. As I remember the question, it was, we certainly don't want volunteers. So the question is, if we are not vaccinated, should we be going to the Deaf Senior Citizen Club? I think you certainly should be wearing a mask, and I'm not sure why. And that's safe. You're going to have to maintain social distancing, and that might be difficult in that type of social club to do that if they're not wearing a mask. I certainly would discourage people who are not vaccinated from going around older persons because that when I had those 5 folks vaccinated and they did get the virus, and we're not quite sure where it came from, but we think it came from some loose rules and some exposure. I wouldn't be participating in a social club vaccinated unless I was pretty aware, and not maintain social distancing unless I was pretty aware everyone was vaccinated, especially if you're concerned about going back and being around other people who are not vaccinated. It is a very low risk, but it's possible that you would transmit. Anybody who's unvaccinated who could transmit to the older person, I think, should not be with that older person. Did I answer that question? Yeah. Okay, thank you. I'm answering the question. Social distancing is still 6 feet. There was some question about it, but it's still 6 feet. The virus travels in small droplets, and it's still 6 feet. And if you're going to wear a mask, make sure it's covering your nose and mouth. And get it. There's some decent surgical masks out there. There's some pretty cheap ones I've seen as well. And you want one that's got some integrity to it, not this really flimsy stuff you can see through. And the bandanas and gaiters and stuff don't work, just as a quick aside on that. But 6 feet is where it's at in terms of social distancing. That's what remains the recommendations. You're a good typist, David. Oh, yeah. I don't, how do we know which one's real and which one's not? I don't know. I don't know the answer to that. And I was afraid you were going to ask that question, and I don't know what the answer is. And I know that's why people may thought about laminating them. I don't know. I think that's a question that they're going to have to answer, and I don't have the answer to that. Question was how. Go ahead. Is everyone seeing all the questions, David? Can they see all the questions? And I guess in the chat, everybody sees them, right? Okay. Well, I'm not surprised we don't have a lot of questions. There's a lot of information that's circulating. I'm delighted that anyone who wants, I probably have made myself very clear on the vaccine and have probably squelched some questions around the vaccine. And in some ways, I apologize for that, because for people to be asking questions is a good thing and getting it out in the open. On the other hand, I think the message is very clear that the safest, most responsible thing to do is to get a vaccine. Yeah, go ahead. Thank you, sir.
Hello, everyone. There's just a few things that
I will sign off.
Thank you, everyone. Bruce, appreciate his participation. I think that just the key here, just reminders, is that, the more people we get vaccinated, the sooner we can get to herd immunity, which is around 80% of the population. And a couple of questions about where to get vaccinations. And there are lots of the pop-ups that Bruce mentioned, but also the New York State Health Department can provide locations, and you could pretty much walk in, as Bruce mentioned, these days. There are some places that require appointments, but they're being very, very, very flexible, and rightly so, to allow people the opportunity to come in
without a appointment and walk in. So keep your eyes peeled for places that in the community would be publicizing churches, community centers, some of the providers. Health providers do have vaccine and are trying to get it out into the community to everyone. So those are just some of the things that I just wanted to reiterate that Dr. Naughton did such a great job at speaking about. Is there anyone else who has anything else that had not been mentioned? I see everybody's lots of good responses on Dr. Naughton, so that's wonderful. I cannot tell you how thrilled we are to have the opportunity to be here with you today. We have not had an opportunity to have a presentation be interpreted this way, and I'm fascinated by your interpreter. Thank you so much for your hard work. You've done a terrific job. I want to thank David for all of his work. We've been talking about this for several weeks in getting to tonight, and he and his team have just done a fantastic job to help to make this a reality. I was very hopeful that things would go well and that we get a chance to do this. So certainly this is an open invitation as things change. Lots of talk about us being at the other end of the tunnel now. So hopefully things will continue to go in the right direction, but things do change in the information and science, as you can see by way of the changes in the masks, how quick things change. So that said, that we certainly can come back at some point and speak to you again if we need to do that. To contact me, so my email address is Broderick, BRODERICK CASON at Univera, UNIVERA healthcare.com, all one word. And David also knows how to reach out to me as well. And so, yeah, we're perfectly willing and able to answer any other questions that might come up later. You also might want to take a look at Univera healthcare.com, our website, where we have tons of other information on COVID in addition to this that we keep updated. So in between presentations, that information is always accessible to people. So I encourage you to do that as well. But we are more than willing to come back and to bring you any updates that we have in a few months. Should there be anything late breaking, hopefully things will stay as they are and get better. But in case that there are some changes or some good, it may be good news with the more increased opportunity for events and such, we will be able to tell you what we do know about those. So that's pretty much all I have. So if you have anything else for me, I guess we can kind of conclude right now. I will stay on because I believe you need me to do that. So thank you everyone who's been here to listen and learn, hopefully today, and encourage you to stay healthy, stay protected, and stay safe. Thank you.